You already know heat waves are dangerous. You see the headlines every summer. Another record broken, another city melting. But what you don't know is why heat kills more people than hurricanes, floods, tornadoes, and earthquakes combined. The reason isn't what you think. It's not just about temperature. It's about something far stranger, something invisible, something that happens inside your body when the air itself becomes poison. That's according to United Nations data tracking mortality since 2000. In the United States alone, more than 21,000 heat-related deaths occurred between 1999 and 2023, with rates accelerating sharply from 2016 onward. 2024 shattered every record. 3 separate heat waves killed over 1,000 people each. Europe's summer heat wave claimed more than 9,000 lives. Saudi Arabia's Hajj pilgrimage in June, 1,301 dead in 6 days. Las Vegas recorded 527 heat fatalities in 2023 alone. Clark County's coroner confirmed 602 deaths in 2024. The numbers keep climbing. Cars flipped, bodies recovered from floodwater. Heat leaves no such evidence. People collapse in their homes, on sidewalks and parking lots. The body shuts down so quietly that by the time someone finds you, it's already over. No drama, no spectacle, just silence. If you value documented climate and health history like this, subscribe. It's the best way to support our work. Also comment from which city you're hearing this from. This script is researched and factual, using sources from the World Weather Attribution Group's 2024 climate report, published December 2024, showing heat waves are the deadliest form of extreme weather, and Nature Communications' November 2023 study on updated wet bulb temperature survivability limits by Vanos and Jay at Arizona State and University of Sydney, which demonstrated that the 35 degrees Celsius threshold vastly underestimates mortality in real-world conditions. Now back to the information. The strange part starts with something called wet bulb temperature. You've never heard of it. Most people haven't. But it's the key to understanding why heat is now killing at unprecedented rates. Wet bulb temperature measures something different than the temperature you see on your weather app. That's dry bulb temperature, just air temperature, wet bulb factors, and humidity. It tells you the lowest temperature water can reach through evaporation. Why does this matter? Because your body cools itself through sweat. When sweat evaporates from your skin, it takes heat with it. But if the air is already saturated with moisture, sweat can't evaporate. It just sits on your skin, doing nothing. Your body can't cool down, your core temperature rises, your organs start failing. A wet bulb temperature of 35 degrees Celsius, that's 95 degrees Fahrenheit. At this point, a healthy young person sitting naked in the shade next to a fan will die within 6 hours. Not from dehydration, from overheating. Their body simply can't shed heat faster than it's gaining it. This threshold has been cited in climate reports for over a decade. The Intergovernmental Panel on Climate Change uses it. Policymakers reference it. But here's the problem. It's wrong. Research published in Nature Communications in November 2023 by Jennifer Vanos at Arizona State University and Ollie Jay at University of Sydney changed everything. They tested real humans in controlled heat chambers, young healthy adults doing basic activities, walking slowly, sitting, resting. The results were shocking. The true survivability limit is much lower than 35 degrees Celsius. In humid conditions with 80% humidity, young adults hit their limit at 34 degrees Celsius. For older adults, 32.5 degrees Celsius. In dry conditions, it gets worse. The limit for older women in hot, dry environments dropped to 21.9 degrees Celsius wet bulb. That's a 13-degree difference from the theoretical model. They called it the PSU Heat Project. They measured exactly when human bodies stopped being able to compensate for heat stress. Across 6 different environmental conditions, no subject reached the 35-degree limit. The mean critical wet bulb temperature was 30.55 degrees Celsius in humid environments. In hot, dry conditions like Phoenix or Las Vegas, it dropped even further. The human body gains heat faster from the hot air than it can lose through sweat evaporation. This explains something that didn't make sense before. Phoenix hit 119 degrees Fahrenheit for 3 days straight in July 2023. That's 48.3 degrees Celsius. The wet bulb temperature stayed around 31 degrees, lower than the old threshold. But 579 people died in Maricopa County that summer. The coroner confirmed it. 645 deaths in 2023, down to 602 in 2024 after the city implemented emergency cooling centers and reflective pavement. The old model said people should survive. The reality said otherwise. That's 125.2 degrees Fahrenheit. But it wasn't just the heat, it was the humidity. Research published in December 2024 by the University of Western Australia analyzed the conditions hour by hour. For 43 hours during those 6 days, the combination of heat and humidity exceeded human physiological limits. Not the theoretical 35-degree threshold, the real limits, the ones that account for age and activity. Pilgrims walked long distances. Many were elderly. 83% of the 1,301 confirmed dead were unregistered pilgrims. They had no access to air-conditioned tents, no misting stations, no transportation. They walked in direct sun. 600 were Egyptian, 60 Jordanian, 35 Tunisian, 132 Indonesian. The Saudi Health Ministry reported over 2,700 cases of heat exhaustion in a single day, June 16th. Most victims collapsed from heat stroke. Organs failed, hearts stopped. Bodies found on streets around the Grand Mosque. The timing makes it worse. The Hajj follows a lunar calendar. It shifts 11 days earlier each year. In 2025, it falls in June again, peak summer. In 25 years, it'll cycle back to August and September, even hotter. A study in the Journal of Travel Medicine published March 2024 by King Faisal Specialist Hospital found temperatures in Mecca are rising 0.4 degrees Celsius per decade, faster than global averages. At 2 degrees of warming, heat stroke risk during Hajj increases tenfold. The pilgrimage that Muslims must complete once in their lifetime is becoming a death sentence. Concrete absorbs solar radiation during the day, asphalt roads, building materials, metal, they store heat. At night, they release it. While rural areas cool down, cities stay hot. The temperature difference can reach 4 degrees Celsius on average. During extreme heat, it hits 10 degrees. A study in Environmental Health published March 2016 analyzed the 2003 European heat wave in the West Midlands, UK, Birmingham specifically. The urban heat island effect accounted for 52% of total heat-related mortality, 90 deaths during 10 days. Without the urban heat island, 43 deaths. The city itself killed 47 people. Cities averaged 1.5 degrees Celsius warmer than surrounding countryside. This heat differential killed 6,700 people, 4.3% of all summer deaths, 1.8% of annual deaths. The study found that if tree coverage reached 30%, 1/3 of those deaths could be prevented. Trees provide shade, evaporative cooling, but most cities have far less green space, urban cores especially, where the poorest live. The deadliest disaster on Earth is also the most discriminatory. Research from KFF published August 2025 analyzed U.S. heat deaths by race. American Indian and Alaska Native people had the highest heat-related death rate. Black Americans died at rates significantly higher than white Americans, not because of biological differences, because of where they live. Historical redlining policies forced communities of color into specific neighborhoods. These areas have less tree coverage, more concrete. Higher urban heat island intensity. Studies across U.S. cities found consistent patterns. Black, Hispanic, and low-income populations experience surface temperatures statistically higher than affluent white neighborhoods. The built environment literally cooks them. Air conditioning access tells the same story. A study in PNAS Nexus published September 2022 examined 115 U.S. metropolitan areas, 45,995 census tracts. Inner-city cores have systematically lower air conditioning prevalence than suburbs. Even when households have AC units, energy poverty means they can't afford to run them. Low-income families face electricity costs that consume over 10% of their income. They choose between cooling and food. Between cooling and medicine, 4 U.S. cities showed stark racial disparities: Chicago, Detroit, Minneapolis, Pittsburgh. Central air conditioning prevalence in black households was less than half that of white households, all 4 cities. Heat-related deaths among black residents showed stronger correlation with high temperatures. Communities of color, the elderly, the disabled, people living below the poverty line. CDC data shows heat kills more than 600 Americans annually on average, more than storms, floods, and lightning combined. The real number is higher. Heat deaths are systematically undercounted. Death certificates often list the underlying condition: heart attack, stroke, kidney failure, not the heat that triggered it. 2023 saw 527 heat-related fatalities confirmed by the county coroner. 2024 recorded 602. But here's the detail that matters. Many victims were found in homes without functioning air conditioning. Others were homeless, sleeping rough in 110-degree heat. The coroner's office processes bodies from May through September, every summer. The morgue at Al Muaysam in Mecca during Hajj 2024 looked similar. Overflow, bodies waiting for identification, families waiting for answers. The common thread: poverty, lack of access, nowhere to escape the heat. This analysis draws from peer-reviewed research, including the Nature Communications study from June 2021, showing people of color and people in poverty bear disproportionate heat exposure in almost all major U.S. cities, with data from satellite measurements of surface urban heat island. Intensity cross-referenced with demographic census data across 175 urbanized areas, providing the most comprehensive spatial analysis of heat inequality to date. Back to the story. The heat wasn't record-breaking everywhere, but it killed more than 9,000 people. Yale Climate Connections reported in January 2025 that 3 of the 20 deadliest heat waves in world history occurred in 2024. Europe's summer wave ranked 5th deadliest ever recorded. Why? Because the combination of factors aligned: high temperatures, high humidity, aging population, urban heat islands, inadequate cooling infrastructure. The World Weather Attribution Group's December 2024 report confirmed what scientists feared. Heat waves are becoming more frequent, longer, and more intense. 2024 was the hottest year in recorded history, 1.55 degrees Celsius above pre-industrial levels. Every year since 2014 has ranked in the top 10 hottest years. As the planet heats, humidity rises. Wet bulb temperatures approach and exceed survivability limits more often. Coastal cities face the highest risk, high temperatures plus moisture from oceans. A study on Hong Kong published November 2022 in Science of the Total Environment examined urban heat island effects during extreme heat versus non-extreme heat scenarios. High urban heat island intensity areas showed elevated mortality even during moderate heat. When extreme heat hit, deaths spiked. The urban heat island amplified baseline temperatures by 1.2 to 4.1 degrees Celsius, depending on location. Energy demand surges, power grids strain, blackouts happen. When electricity goes out during extreme heat, people die fast. A 2021 study in BMJ analyzed this. Air conditioning becomes a double-edged sword. It works until it doesn't. Grid failures during heat waves have killed hundreds. People who depended on AC suddenly have no way to cool down, no acclimatization to heat. Core temperatures rise rapidly. Texas experienced this in June 2025. A heat dome covered the state. 255 million Americans under heat warnings. Power outages hit. A woman in St. Anne, Missouri, died when her air conditioning was shut off. She had underlying health conditions. The heat killed her. A study tracking deaths from 2001 to 2019 found 13% of warm month deaths were associated with extreme heat in unair-conditioned prisons. Inmates couldn't escape, couldn't cool down, just suffered. People of color are overrepresented in prison populations. The intersection of inequality and heat becomes a death trap. This creates a gradient. Heat flows from hot to cold, core to skin, skin to air, but when air temperature exceeds 35 degrees, the gradient reverses. Heat flows from air to skin, skin to core. Your body starts gaining heat instead of losing it. Sweat is your only defense. Evaporative cooling. But in humid conditions, sweat can't evaporate. It pools on your skin, drips off, takes no heat with it. Your core temperature climbs 37, 38, 39. At 40 degrees Celsius, organs start failing. 43 degrees, heat stroke. Death soon follows. The cardiovascular system collapses first. Your heart pumps blood to your skin to radiate heat. Blood vessels dilate. Blood pressure drops. The heart works harder. Blood volume decreases from fluid loss through sweat. The heart can't maintain output. Organs don't get enough oxygen. Kidneys fail. Brain function deteriorates. Proteins in your cells denature, like cooking an egg. Once that happens, it's irreversible. You die, even if cooled down afterward. The damage is done. A study in Frontiers in Public Health, published October 2020, examined cardiovascular disease mortality in urban heat islands. Shenyang, China, from 1984 to 2017. Urban heat island effects on cardiovascular deaths increased mortality by 28.8%. The affected areas expanded from city centers outward. 3 evolution stages. High-level patches increased in number and dominance. People living in these zones died at rates far exceeding those in cooler areas. The mechanism? High temperatures activate inflammation, damage endothelial cells and coronary arteries, increase permeability, reduce antioxidant activity. Cholesterol deposits accelerate. Atherosclerosis worsens. Coronary heart disease kills. This systematic undercounting means the real toll is far higher than official numbers. Ruby Mellon at the Washington Post reported in July 2024 that tracking heat deaths is notoriously difficult. Many jurisdictions lack protocols. Coroners don't have resources. Bodies decompose quickly in heat. Autopsies are expensive. Poor areas can't afford them. The deaths vanish from statistics. $402 billion in total damage, 20% above the 10-year average. The United States alone recorded $27 billion disasters. 17 were severe storms, 5 hurricanes, 1 wildfire, 2 winter storms, 1 drought, 1 flood. But heat? Heat doesn't make the billion-dollar list. It doesn't destroy buildings, doesn't flip cars, doesn't flood cities. It just kills people, quietly, efficiently, disproportionately. Philippines experienced the same. Bangladesh shut schools. The exact death counts remain uncertain. Poor countries lack death registration systems, no medical examiners, no official tallies. People die in villages, rural areas, no one counts them. The World Weather Attribution Report noted this: heat kills, but documentation fails. The deadliest disaster stays hidden. But most of the world has nothing. Sub-Saharan Africa, South Asia, Latin America, huge populations, rising temperatures, no infrastructure, no early warning systems, no cooling centers, no data, just death. A study in Nature Climate Change published July 2021 examined heat mortality attributable to recent human-induced climate change. The analysis found that heat-related deaths will increase by multiples. Not percentages, multiples. By 2080, Europe alone could see 50 times more heat deaths than 2023 levels. Climate change augmented by urban expansion, cities growing, populations aging, heat intensifying. Colombia faces a 2,000% increase in heatwave mortality between 2031 and 2080 under high emission scenarios. Moldova sees a 150% rise. These aren't distant futures. 2031 is 6 years away. The 35 degrees Celsius wet bulb threshold is dangerously wrong. Real limits are lower, much lower, and we're already hitting them. Hajj 2024, 43 hours beyond survivability limits. Europe summer 2024, repeated exceedances. Phoenix 2023. Sustained dangerous conditions. The locations change. The story doesn't. Heat combined with humidity creates conditions human bodies can't handle. Age lowers the threshold. Poverty removes escape options. Urban design amplifies exposure. The result is mass death. But there's something even stranger happening. Something that makes this disaster unique among all others. Heat adaptation has limits. You can adapt to many things. Build stronger buildings for earthquakes. Elevate homes for floods. Reinforce roofs for hurricanes. But you can't adapt past physiology. Your body has hard limits. Once wet bulb temperature exceeds your personal threshold, no amount of acclimatization helps. You die. The only solution is artificial cooling, air conditioning, cooling centers, technology. But technology requires infrastructure. Electricity, money, access, all the things poor communities lack. Coolest areas to hottest. They found evidence of acclimatization to heat, but not complete adaptation. People in hot zones showed some physiological adjustment, but mortality still increased during extreme heat. The urban heat island killed. The body adapted partially, not enough. Physics wins. This creates a cruel trap. Rich people buy air conditioning, cool their homes, survive. Poor people can't afford AC or can't afford to run it. They suffer, they die. The inequality isn't just about money, it's about survival itself. Climate change creates a world where wealth determines who lives and who dies during summer. Not metaphorically, literally. Have money? You live. Don't have money? You're at severe risk. A study in Nature Communications, published November 2021, examined cooling needs through 2050. Brazil, India, Indonesia. Between 20 and 30% of households won't meet cooling needs. Heat stress becomes chronic, permanent. By 2050, 60 million Europeans and 640 million Indians will face heat waves without air conditioning. The richest, 10%? 80% will have AC. The poorest, 10%? Between 2 and 23%. The gap widens. The rich stay cool, the poor cook. North America is over-equipped. Almost everyone has AC, but access still varies. Urban cores, low-income neighborhoods. Even in air-conditioned America, heat kills. Because energy poverty means having an AC unit you can't turn on. Because homelessness means no indoor space at all. Because power outages mean your AC stops working. The infrastructure that should save lives becomes another source of inequality. Work requires outdoor exposure. Studies show outdoor workers account for 18,970 deaths annually worldwide from heat exposure. These aren't people caught in surprise heat waves. These are people working, earning money, supporting families, dying from their jobs. Greece and Spain responded, mandated longer breaks during peak heat, required cooling facilities with cold water, wearable sensors to monitor core temperature. But most countries have no such protections. Workers die, no one notices, no compensation, no accountability. The mechanism that kills outdoor workers is the same. Core temperature rises, sweat production maxes out, dehydration sets in, judgment deteriorates, heat exhaustion feels like fatigue. People don't realize they're in danger until they collapse. By then, core temperature is already 41 or 42 degrees, organs failing, brain swelling, seizures, death. Co-workers find bodies, ambulances arrive too late. Heat stroke kills within hours, sometimes minutes. There's a narrow window for intervention, ice baths, intravenous fluids. Aggressive cooling, miss that window, death is almost certain. By the time they stop responding, it's critical. Vehicles become ovens. Temperatures inside parked cars reach 70 degrees Celsius, over 150 Fahrenheit. Children left in cars die in minutes, not hours, minutes, every summer. Multiple deaths, preventable. But they keep happening. Heat doesn't discriminate by intent, only by exposure. Antipsychotics. These drugs interfere with the body's cooling mechanisms. Combine that with chronic diseases, diabetes, kidney disease, cardiovascular disease. The elderly become heat intolerant. A study in Nature Communications, November 2023, found heat-related deaths among adults over 65 have surged 85% since the 1990s. Not because they're weaker, because the heat is more intense, more frequent, more deadly. Care facilities face this challenge. Nursing homes, assisted living. Many lack adequate cooling, budget constraints, old buildings, inadequate infrastructure. During heat waves, elderly residents die in their rooms. Staff find them unresponsive, too late for intervention. France learned this during the 2003 heat wave. 15,000 deaths, many in care facilities. The country implemented heat action plans, better monitoring, cooling protocols, check-ins. It helped, but the problem persists. Facilities in poor areas still lack resources. The deaths continue. Mental illness correlates with heat mortality. Psychiatric medications affect thermoregulation, antipsychotics especially. They block heat loss mechanisms. People on these medications are at extreme risk during heat waves. Studies show elevated mortality rates. Social isolation compounds it. People living alone, no one checking on them, no one noticing when they stop responding. Bodies found days later, advanced decomposition, another heat death, another statistic. Now they hit everywhere. Pacific Northwest, 2021, temperatures hit 49 degrees Celsius in British Columbia, 121 degrees Fahrenheit. 700 people died across Oregon, Washington, and British Columbia. Homes lacked air conditioning. People weren't prepared. Didn't understand the danger. By the time they realized, it was too late. Bodies found in apartments, houses, sidewalks. The coroner system overwhelmed. Refrigerated trucks brought in for overflow storage. A disaster in a region that didn't think it needed to worry about heat. Canada's infrastructure wasn't built for this. Buildings designed to retain heat, maximize insulation, perfect for cold winters. Death traps during heat. No AC, no ventilation. Concrete boxes absorbing solar radiation. Inside temperatures hit 50 degrees Celsius. People cooked alive in their apartments. The government issued warnings, open windows, seek cooling centers. But many didn't leave homes. Fear of COVID, mobility issues, lack of transportation. They stayed, they died. Unexpected heat waves in regions without heat infrastructure. June 2024, Fennoscandia, Finland, Sweden, Norway, temperatures far above normal. The World Weather Attribution Group analyzed it, found climate change made it significantly hotter and more likely. People in these regions evolved for cold, buildings designed for cold, lifestyles adapted to cold. Sudden heat kills, no preparation, no infrastructure, no cultural knowledge about heat danger. Deaths occur, often uncounted, attributed to other causes. The heat stays invisible. The future is already visible in models. Climate scientists run simulations, representative concentration pathways, different emissions scenarios. Even the optimistic pathways show deadly heat becoming routine. The pessimistic ones show uninhabitable zones. Wet bulb temperatures regularly exceeding survivability limits, not for hours, for days, weeks. Entire seasons where going outside means death. The Persian Gulf, parts of South Asia, Central America, Northern Australia. These regions face potential uninhabitability by 2070, not might. Will, under current emissions trajectories. Crop yields plummet when wet bulb exceeds plant tolerances. Food supply disruption. The cascade effects multiply. Heat doesn't just kill directly, it destroys the systems that support life. Economic productivity drops. People can't work outdoors. Indoor work becomes harder. Cognitive function impairs. The global economy contracts, not gradually, sharply. By 2050, outdoor work capacity decreases by 15 to 25% in tropical regions. Construction, agriculture, infrastructure maintenance. These essential jobs become impossible during peak heat. Either work stops or workers die. The choice is, that's stark. Societies must choose between economic activity and human life. Under extreme heat, you can't have both. Cool pavements. These interventions work, but they require money, planning, implementation, time, and they primarily help rich countries. Rich neighborhoods, poor regions get nothing. The gap between who survives and who dies widens. Buildings engineered for tropical conditions, extensive tree coverage, public cooling spaces, it works. But Singapore has resources, wealth, governance capacity. Most cities don't. Lagos, Karachi, Manila, Delhi. Massive populations, extreme heat, minimal infrastructure, millions at risk. No clear solutions. The coming decades will test whether these cities can adapt fast enough. Current evidence suggests they can't. Small island nations, they didn't cause climate change, but they'll pay the highest price. Not in money, in lives, in suffering. The rich countries that industrialized and emitted most of the carbon, they have resources to adapt, to build cooling infrastructure, to survive. The moral dimension is unavoidable. This isn't just a climate disaster, it's a justice crisis. And even when money flows, it often doesn't reach the most vulnerable. Bureaucracy, corruption, misallocation. Meanwhile, people die, summer after summer. The death toll rises, the pledges continue, the gap between rhetoric and reality grows. Check on elderly neighbors, stay hydrated, use cooling centers. These help, they save lives, but they don't address the root cause. The planet is heating. Emissions continue rising. Fossil fuel use remains near record highs. Oil companies post record profits. Climate summits issue statements. Nothing fundamentally changes. The heat intensifies, the deaths multiply, the future closes in. Your co-worker, your family member. Then the statistics become personal. The invisible disaster becomes visible, but by then, for that person, it's already too late. Urban heat islands amplify exposure. Poverty removes escape options. The combination is lethal, and it's accelerating. Every fraction of a degree of warming pushes more places closer to the edge, more people into danger, more deaths each summer. The trajectory is clear, so is the endpoint. A world where summer itself becomes the most dangerous season, where stepping outside during peak heat means risking death, and where entire regions become uninhabitable for parts of the year. This isn't speculation. This is physics, biology, mathematics. The equations don't lie. The 2024 Hajj stands as a preview. 1,301 people dead in 6 days. Modern times, modern medicine, modern infrastructure. Still, over 1,000 dead from heat. Now imagine that same scenario playing out across cities, across continents, not during a pilgrimage. During routine summer, no specific event. Just Tuesday, Wednesday, Thursday. People dying because they went to work, walked to a store, existed in the wrong place at the wrong time. This is the future we're building, with every ton of carbon emitted, with every summer that passes. With every decision to delay action, the heat tightens its grip, the death toll mounts, the window narrows. Not because of the temperature alone, because of the combination. Heat plus humidity, heat plus poverty, heat plus inequality, heat plus aging infrastructure, heat plus climate change. Each factor multiplies the others. The result is a disaster that kills quietly, efficiently, discriminately. And increasingly, evidence that ground temperatures during the 2003 heat wave remained elevated for weeks after air temperatures cooled. The soil itself stored and radiated heat long after official records said the danger passed. Urban substrate acting as a thermal reservoir, prolonging exposure. Extending the killing period. This means heat deaths attributed to other causes weeks after a heat wave might actually be heat deaths. The delayed release of stored thermal energy creating extended danger windows. The disaster lasts longer than we thought, kills more than we counted. The heat doesn't just strike, it lingers, waiting, patient, lethal.